In clinical practice today, we see a lot of complex patients, both that present with lymphedema, various forms of swelling, as well as chronic wounds. And more, we're starting to see a combination of patients with complex edemas in the presence of integumentary dysfunction. And for the longest time, these two disciplines have been really kind of siloed, where you have wound care over here and wound management, and then you have lymphedema and chronic edemas over here. And the beauty behind ILWTI, the International Lymphedema and Wound Training Institute, it's the only dual certification that integrates integumentary dysfunction or chronic wound management in the presence of patients with lymphedema and chronic edemas. And it's so vital in today's clinical practice because you cannot separate these two conditions. Lymphedema leads to integumentary dysfunction, and oftentimes integumentary dysfunction leads to chronic edemas and lymphedema. And what's nice about the approach through ILWTI is you get that integration of the two systems. You appreciate the interconnectedness of those two systems, not only in how to assess and examine these patients, but how to intervene on their behalf to facilitate the best outcomes you can possibly achieve as a clinician, whether you're a PT, an OT, or a nurse. It's really a beautiful interrelationship helping to bring together these two conditions that are so intimately involved rather than having them separated in these different silos. Here at Nova Southeastern University, we've been very fortunate because we established a relationship with ILWTI about 4 years ago and started bringing the CLWT course to campus and offering it once a year. The chair of the physical therapy department as well as the director of the physical therapy department have realized the value of the CLWT dual certification course. And just this year, we've actually incorporated it into our Doctor of Physical Therapy program, the transitional program. So now it is actually an elective course that is part of the transitional DPT. And what's exciting is this year we've had 6 students, international students, that have been taking the CLWT course as part of their transitional DPT. And it's been a wonderful marketing opportunity for NSU, and it's also afforded our students an opportunity to get certified, dual certified, in something that they otherwise may not have had the opportunity to do. We're seeing much more complex patients nowadays, so it's really critical to appreciate this material, but also be able to put it into context, because there are just so many patients with these conditions, and yet we need people that appreciate the complexity of the presentations that these patients are coming in with respect to lymphedema, or whether it's primary, secondary, but also the chronic wounds that they're coming in with. And this way, you can manage both aspects. You'll know how to appreciate and assess and treat that chronic wound in the presence of lymphedema. And at the same time, you'll know how to modify your lymphedema interventions based off of the presence of the wound. So it's a really unique, very experiential learning experience, and you come away with just a whole nother level of clinical expertise.